Hi, this is Jen Rubin for The Contrarian. I'm delighted to have with us as our special guest Dr. Rob Davidson, who is the executive director of a group called the Committee to Protect Healthcare. And it is a activist group that goes beyond the doctor's office, beyond the hospital, because public health, of course, is part of what keeps you and your loved ones safe, healthy, alive. And I brought him here because he and his group have done something extraordinary. Dr. Davidson, you guys organized a very large letter. Tell us a little bit about that and its purpose.
Yeah, thanks for having me. Our organization, nearly 30,000 doctors, and basically we exist to, tell the stories of our patients in service to our patients, to try to make healthcare more affordable, more accessible, and just to promote the health of our patients and our communities. And so we went out to the advocates who have worked with us previously on many healthcare issues. And we went out with this letter. I was concerned. I'm an emergency physician, been doing that over 25 years. My wife's a family physician. The people I work with, we're all very concerned about RFK Jr. and his very, very concerning views on vaccines and other healthcare issues. So we went out to these advocates and we've confirmed over 15,000. We're pushing up now, I was just told the other day, probably around 18,000. We've confirmed physicians. There are some nefarious players out there who've tried to play with our form, and we've certainly gotten rid of those folks in our count. But significant number of docs who are equally concerned that RFK Jr. as the Secretary of Health and Human Services would just be such a devastating blow to their ability to care for their patients.
What are your main concerns about him? We know something about his anti vax views. Is that the only issue, or are there other issues as well?
That's not the only issue. That's certainly a big issue. It's concerning that he has been out there with the Children's Defense Fund, advocating against vaccines. He said he goes up to people on hiking trails and tells them to not vaccinate their children. That's strange and very concerning behavior from an individual. But, individuals get to behave how they wish. It's a free country with free speech. It's concerning to put this guy at the head of the biggest organization controlling healthcare in this country, to be the mouthpiece of public health. That's the concern. We were worried that they could change childhood vaccination schedule. We're worried that they may add things like autism, which has been shown conclusively to not be caused by vaccines, specifically the MMR vaccine. We're concerned they could add that to diseases that are considered related to vaccines. So I think that's a big one. Certainly, he's got some very strange health views. He has said very, very clearly he is not sure HIV causes AIDS. That is a concern. HIV does cause AIDS. People doing research, the amazing work since I remember in the mid 80s when I was a teenager, when AIDS was a death sentence, and now it's a chronic disease, right? And we can manage it. We can help prevent people from getting it. We can help people live full, healthy lives with HIV and not move on to get AIDS. But we're also concerned about his really lack of any record talking about Medicaid, Medicare, the ACA. We know Trump, we know Congress, many people in Congress want to go after Medicaid to pay for tax cuts for billionaires and massive corporations. And if we have someone in HHS who doesn't really have a strong opinion, or we don't know their opinion, I'm concerned, and we're concerned that they could get rolled over, and this administration could get what they want. Savings from taking healthcare away from poor people and the elderly and the disabled to pay for tax cuts. I think that those are all such critical issues.
One of the things the administration has done is freeze trials, medical trials, freeze communication coming from NIH. Can you explain how damaging that is to the health and really survival of many people?
Well, I know that we in the medical community depend upon communication from the agencies to let us know what's going on. I mean, we have H5N1 avian flu out there, going that's hitting flocks of birds, other animals. There's transmission to humans. We need to know to what extent that is happening in what communities. We need to know if that is starting to have human to human transmission, right? This could be on the verge of another pandemic, and we need to know kind of the leading indicators of if that's coming to pass. The other thing is so many people with chronic diseases, people with cancer, people with chronic rheumatologic autoimmune diseases, people working in infectious diseases who, when they put a freeze on those people getting relief that they're depending upon. You know, the NIH is such a huge player in basic science research in all of these areas, then allowing, you know, academia to kind of get involved and take over and get us to therapeutics that can help change people's lives. And when they put a freeze on that, the whole system comes to a halt. It's if I were one of those patients, I would be absolutely terrified.
Absolutely. Now, if a doctor or other medical professional gets a chance to watch this, what should they do? How can they get in touch with your organization? How can they sign the petition or the letter, rather?
Yeah, doctorsagainstrfk.com is the landing page that will get them right to a series of actions. One is signing the letter. One is sending emails to their senators to let them know they are opposed to this. We've had thousands of people do that. Another is to email the AMA and email their professional society, because those groups have largely been mute on this. And we feel those groups are representing us as physicians, but really representing our patients, right? The only reason we do what we do is to serve our patients. That's it. And if these organizations are going to be silent, we need to let them know that's a problem. We need to urge them not to write $5,000 PAC checks to senators who support this guy. We need to put pressure from without, pressure from within. But yeah, doctorsagainstrfk.com is the place to go.
Terrific. You touched on something that is a problem across the board with an authoritarian regime, and that is that science, facts, reality gets crushed, and rumors, conspiracy theories, junk science take their place. And that's dangerous not only in the medical field, but in all areas of our life, whether it's the FDA, whether it's the NIH, whether it's the Weather Service. So thank you for being with us, and good luck in your efforts. We hope the Senate is listening. So we'll have you back again. Thank you so much. Bye-bye.
Thank you.